folks. My name's Ron Ray with Turning 65 Solutions, and today we're going to be talking about Medicare Advantage or Medicare Part C. Now, everything that I'm going to be giving to you today comes out of this book right here called Medicare NU 2021. And if you look in the back of this book, it actually has some good reference information about Medicare Advantage health plans in your state. So it's state by state and then broken down county by county. Now, these books are published in the summertime, and quite a bit can change from when the book was published and when you may be doing your research. So this is a good guide, but don't let it be your only reference. Be sure and verify the information in this book with either the insurance company itself and your doctors, and hopefully, also contact a good local independent insurance agent who can kind of help you decipher some of the stuff in this book. And that's what I'm going to do for you today. So Medicare Advantage is part of the Medicare system, but the way it works is, if you recall from previous videos, when you go on Medicare, you've got two choices, either Original Medicare or Medicare Advantage. Now with Original Medicare, this is where you keep Original Medicare A and B, and then you add in a Medicare supplement. Down here we talked about those before, like a Plan G or a Plan N, and what that does is pays all or most of your out-of-pocket cost up here, and then separately a prescription drug plan to help out with the prescriptions. But with Medicare Advantage, what happens is you continue to pay the Medicare Part B premium. For most people in 2021, that's going to be $146.80 a month. But now Medicare sends that money over to this private insurance company that you choose, and they combine your coverage and administer your health care for you, taking Medicare out of the picture. Now I want to be clear, you don't lose Medicare. You're still in the system, but what's happened is for that calendar year, you've been contracted out to the insurance company. Medicare kind of says, here's the money, you take care of them. And now they make the rules and you play by their rules. These are the HMOs and the PPOs. Okay, so if you recall from our previous video on Medicare supplements, we were comparing apples to apples. So Plan G from one company is identical in benefits to a Plan G from every other company. So it's really apples to apples. But with Medicare Advantage, it's not apples to apples. Every plan from every company can be completely different. Now there's minimum standards that they have to meet set by the government, but beyond that, they can do what they want to. Okay. Now the advantage is that in addition to the $146.80 that you are going to continue to pay, that doesn't go away in most cases. You will pay little or no additional premium for your plan. So most of the HMOs still have a zero monthly premium in addition to the Part B premium. The PPOs cost money, and some of them can be pretty expensive. They can even cost as much or more than a Medicare supplement. So you've really got to be careful there. Now, where you will pay is when you go to the doctor, when you use the insurance. Now you've got cost sharing. You've got co-pays and deductibles and co-insurance. So now you go see your family doctor, you'll probably have a small copay there. Some of the plans will have a zero copay for the family doctor, but it might not be too much. If it does have a copay, like a PPO might have a $5 or $10, $15 copay. Go to the specialist, you'll definitely pay a copay there, usually somewhere between $20 and $50, depending on the plan. And hospital, you go to the hospital and spend the night in the hospital, you'll definitely have a per day copay there. A good example of how these work would be, if you're admitted to the hospital and you spend the night, you'll pay $300 or so per day for the first 5 to 7 days, and then nothing after that. For outpatient surgery, you go to a little clinic for an outpatient surgery. You'll pay a small facility fee, $200 or $300, depending on the plan and the facility. You may also pay your doctors there separately. So the surgeon, anesthesiologist may both bill separately, so watch out for those bills. All your diagnostics, MRIs, CAT scans, x-rays, lab work, blood work, emergency room visits, ambulance rides, urgent care centers, a portion of those bills is all coming out of your pocket, so you got to watch out for it. Now remember, Medicare's out. They've essentially said, here's the money, you take care of them. And now the insurance companies get to set the prices. And by prices, I mean what they pay the doctors. So that means that this plan pays that doctor a little bit less than this plan does, and this plan pays that doctor a little bit less than this plan does, and on down the line. Now you have a list of doctors, a doctor network that you're allowed to go to. And If you go to another doctor that's not on the list, in the cases of an HMO, you're just on your own. They're not paying a penny. Now, a PPO is more open, usually will allow you to go to doctors that aren't on the list. However, you will pay more. You'll pay the out-of-network cost, which can be 2 or 3 times the in-network cost. You also have something called managed care, which means that for anything that's not a life and death emergency or just a regular office visit, you have to get permission from the insurance company first, and they can say no. Now, they're not going to say no, you can't have that treatment. They're going to say no, we're not going to pay for it, which for most of us means you can't have it because you can't afford it. It's why you have insurance in the first place. Or they can put you on what's called step therapy. And step therapy goes like this. We're not going to pay for that treatment yet. We want you to try this other cheaper treatment first. And if that doesn't work, then we'll pay for that one. Which does what for you? It prolongs your treatment, prolongs your illness. If your doctor wanted you to have that treatment, he would have ordered it. So you may die before you get back over there. And that happens. Okay, so that's managed care. Also means you may need referrals from your primary doctor just to go get permission to go see your specialist. That is all part of managed care. Now, those are kind of the drawbacks. So what are the good parts about them? The good parts are, number one, they do limit your out-of-pocket cost. So remember, with original Medicare, there's no limit to the amount of money that you can pay out of your pocket. But with Medicare Advantage plans, they do have an out-of-pocket maximum every year. And depending on the plan you pick and the area that you're in, it ranges somewhere between about $4,000 and about $7,500 per year. Okay, so it can still be a large amount of money, but it is limited. And some of them do still combine, in fact, most of them, but not all, so you have to be careful, do still combine the prescription drug plan all into one plan. So you've got your hospital coverage, your medical coverage, and your prescription coverage all in one plan, so it's very convenient. And next, most of them do still provide those extra benefits that Medicare doesn't cover, like dental and vision and hearing and over-the-counter and rides to the doctor for some of them. And there's some that specialize in chronic conditions like diabetes or heart disease and provide extra coverage beyond what Medicare provides for those things. Some of them do still provide that free health club membership. If you've ever heard your friends talking about silver sneakers, that's what that is. So you take your ID card down to the local gym, and if the gym participates in the program, most of them do, you get a free membership and you can go to your gym for free. Now remember, these are one-year contracts. They have one-year contracts with Medicare, one-year contracts with the doctors, and one-year contracts with you. If any one of those 3 things changes, well, you may find yourself shopping for new insurance or shopping for a new doctor. And that can happen every year. And you can only change plans once a year during the annual enrollment period from October 15th to December 7th. And then once again, you get a one-time chance to change from January 1st to March 31st in case you made a mistake during the annual enrollment period. And then there's several various special enrollment periods, or SEPs, that come up from time to time if you move out of the plan area, or if your company goes out of business or moves out of your area, or if there's some natural disaster that occurs in your area during a regular enrollment period. You may be given a one-time opportunity to change plans or get a new plan. Those don't come up very often, but when they do, it's a good thing to review your plan and see if you can take advantage of that period to get a better one. That's really a quick crash course on Medicare Advantage, Medicare Part C. If you have any questions about this, or if you want help getting a plan or finding a plan or reviewing your plan, please give us a call. The number is 830-217-6711. You can also find us on the web at www.t65s.com. Until the next video, folks, have a great day. We'll see you.